Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you for our discussion for case number 23 and on to today's business. So I'd like to ask you to join us in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. We are successful in the past 2 years doing that. To help us achieve this, just watch and finish the ads in our videos. And please, if you share this video and the rest of the videos in the channel to at least 10 of your friends, we will pray for your success. Thank you for doing so. Once again, share this to at least 10 of your friends and we will pray for your success. I'd like also to thank the anonymous donors who sent cash donations to our scholarship program, especially this lady here who sent 20,000 pesos for the program. Thank you very much. And I'd like to make this public advisory. Dr. Ray Gapuz and the mentors of the Ray Gapuz Review System are not part of another center named Gapuz Review Academy or Gapuz Review. So if you don't see any one of us in your class, that's not a Ray Gapuz System class. So this is case number 23. And before we discuss, let me congratulate Leslie and Bernardo for passing the New York Board of Nursing. And this is what you would want to share to us. I'm finally a USRN. Thank you, Lord, for answering my prayer. I offer this success to you. To my very supportive family, heartfelt thanks. To Sir Ray Gapuz and the whole RAGRS team, thank you. You are the game changer. I can't do it on my own without your system. I utilize all your unlimited resources, 3 comprehensive reviews, 1 bootcamp, 2 quick fix face-to-face, finish all the activities in the core shell, answered TOP, watch the latest YouTube videos, follow the study guide from Sir Ray, and lastly, the powerful 311 book that I read a day before my exam. To ITAPS Gapuz, especially Miss Faith, thank you for the very fast and hassle-free application and processing of my papers. I started my application mid-February of 2024, got my eligibility May 1st week, and applied for ATT. Thank you for delivering exceptional service from the very start up to my quick fix result. During my exam, I applied all the strategies that Sir Ray taught us, the Think First, SAQA, Max, and remembered to go slow. My anxiety kicks in. When my computer did not shut down at 85, I calmed myself and proceeded answering. Then on question number 90, my computer shuts off at exactly 3 hours. To my colleagues, believe that you are next. Just trust our AGRS system. It will all be worth it. Now, let's talk about the condition which you can potentially develop from our very rigorous system of doing the NCLEX test prep. So let's talk about migraine. But before we do so, let me congratulate one of our young passers, Joshua H. Hermenegildo. From the City University of Pasay, he just graduated last year and became a Philippine registered nurse just December of last year. And look, in less than a year, he's now a USRN. He passed the New Mexico Board of Nursing last September 27, 2024. Congratulations, Joshua. And this is his success recipe. Trust the system, trust yourself, and you'll be next. Good day, Sir Ray. I'd like to share some good news. I passed the NCLEX RN. I took my exam last Friday, September 27, 2024, and after 3 hours and 40 minutes, my computer shuts down at 85. The NCLEX RN is a different type of exam, systematic and methodological. I have 5 case studies and mostly standalone questions. The 5 case study is lengthy, but I always tell myself to go slow. Don't rush. I find the standalone question to be more difficult. You'll never see keywords or clues as most questions are one-liner. They really test the concept mastery. Whenever I encounter a difficult question, I pray, read the question, and go back to the function and read the question and go back to the functional concept method. That's his success recipe. Way to go, Joshua. Great job. And my NCLEX journey is extensive, and he attended the boot camp, 1 cycle of comprehensive review. He answered TOP, that's our test overview program, and he did the core shells, that's our Q bank with videos, which I answered twice, and 2 quick fix. All parts of the program are helpful and complementary to the NGN. Most of the questions I encountered were discussed in the quick fix. I told you, don't miss my quick fix. To be honest, sir, our Q banks from TOP and core shells were more difficult than the questions I have encountered. The books that helped me the most are Quick Fix in Pharmacology, the new NCLEX 311, which I co-edited, and the nursing reminder sheets. All of your YouTube videos are helpful. I encountered the concept you've discussed in the 2020-2021 video. Thank you, Sir Ray, for your guidance. You're the best. To our mentors, Ma'am McLean, Ma'am Che, Sir Francis, Ma'am Sol, Ma'am Nicole. Thank you to all of you. Lahat po kayo magagaling. All of you are good. Thank you to my Ray Gapuz Review System family. Our system really works wonders. To my family, thanks for your support. Most importantly, thank you, Lord. That's from Joshua Hermenegildo from the City University of Pasay. Way to go. Now, let's talk about migraine. Now, migraine is a genetically influenced disorder manifested by moderate to severe headache that comes with nausea, vomiting, dizziness, and light and sound sensitivity, which could potentially trigger spasm of the arteries in the brain. Sometimes the spasm could come after eating some foods with MSG. So it's important to avoid MSG and those that contains thiramine or those that have preservatives. So there's an herbal remedy for migraine headache. Here's a tip. It's called feverfew. Okay? Feverfew is for migraine headache. So before a migraine attack, an aura described as flashes of light or blind spots would usually occur. And the symptoms that may occur after migraine attack includes, remember, FMNI, food craving or frequent yawning, just like having narcotic withdrawal when your client would have excessive yawning, mood changes, neck stiffness, like a client having meningitis, and increased urination. So what are the triggers? Remember, shades. It could be triggered by stress, hormonal changes in women, additives in food like MSG, drinks, extreme weather, and sensory stimuli, as well as sleep changes. Those of you who either are insomniac or they have difficulty sleeping at night because of some problems, emotional concerns, or pain, then they are at risk for having migraine. So treatment of migraine includes your triptan, sumatriptan, frobatriptan. Okay, these are all indicated for clients with migraine. The antiemetics like chlorpromazine, which is an antipsychotic with antiemetic properties, your Jipan, Savegipan, okay, nasal spray, your lasmiditan oral tablets, and dihydroergotamine or migranal. Okay, these are all considered as treatment for migraine, but focus on the triptans. Sumatriptan, frobatriptan, eletriptan. That's a tip. And of course, before we use what we've discussed to answer a case, let me remind you that the pages you're asking me to highlight from my book, NCLEX RN 311, the Next Generation Quick Fix, I have outlined them here. So let's read the success recipe of one passer who used the book. Her name, Aiza. Good morning, sir. Ray, pasado po ako, sir. Walang hanggang pasasalamat po sa inyo. So what she's saying is, I'm forever grateful. I just passed my test. Binasa ko lahat ng binigay ni Miss Joanne, yung pointers. She read everything that Miss Joanne gave, the pointers. NCLEX 311 new edition. 1 week bago ako mag-exam. Alam ko po, di ako papasa ng 85 questions. Kaya nagdasal ako na sana umabot ako ng 150 questions. Nag-stop po ako at 101 and case study po ay bowtie. Hindi ko po alam bakit ako nakangiti. Tumayo. Wow. Kahit alam kong pwedeng bagsak o pasado ko. So what she's saying is that when her computer did not shut off at 85, she prayed that she would reach 150, but the computer shut off at 101 after a bowtie question. So she doesn't know and she can't explain why she was smiling after the test, even if deep in her heart, she knows that she may pass or fail the test. Okay, so let's answer case number 23 using the concepts that we've talked about. So a client with migraine headache describes feeling severe pain even if the trigger does not normally provoke pain. Now that's an important phrase to consider, severe pain even if the trigger does not normally provoke pain. So this question is more likely going to ask us about a terminology that we can use to label what the client has shared in terms of the symptoms. So which term can be used to describe the client's symptom during documentation? Is it allodynia, peripheral neuropathy, analgesia, or odontalgia? Now, odontalgia is plain and simple toothache. Analgesia is actually the absence of pain. Peripheral neuropathy indicates nerve damage, and it comes with tingling sensation. So allodynia is severe pain that is triggered by something that does not normally provoke pain. So the answer in this question is 1, allodynia. So may I invite you to join me in my bootcamp. It's called the Quick Fix Bootcamp, and it's going to be held at the Mount Crest Hotel from November 13 to 24 in Baguio City. Sessions begin at 8 a.m. to 6 p.m. Please don't get absent. Don't miss any single day. 1 day of absence means it's equivalent to a 1-month lesson. So once again, if you want a quick way to pass the test, join me in the bootcamp. Okay. So join our hundreds and thousands of passers from more than 30 countries worldwide who have benefited from our system. And at our system, at Ray Gapuz Review System, our tools are published by world-renowned publishers, and we have our own learning management system that covers all the NCLEX subjects, and these are the highlight. It's being updated regularly on a monthly basis. And of course, we're the only system that have our own next generation NCLEX simulation room, and we keep our classes at a comfortable number. So let me invite you to join me in our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, a QBank, plus the 3 books, the NGN strategies and sample questions by me, and of course, the quick fix session. Our fee starts at $3,499. So once again, this is your mentor, your fact check buddy Ray Gapuz at your service, saying a functional concept today helps keep your NCLEX RN fears away. Those who are taking the test, good luck and God bless, and see you in our next video.